Control and Prevention estimate that 600,000 to 800,000 needle stick injuries occur every year among healthcare workers, most often among nursing staff. But anyone who handles sharps can be stuck, including lab workers and housekeepers, particularly when disposing of needles, drawing blood, recapping needles, even handling contaminated trash and linens. To respond to the problem, Congress passed the Needle Stick Safety and Prevention Act, requiring OSHA to change the bloodborne pathogen standard. The revision added new requirements for employers, such as using safer sharps to reduce exposure, involving employees in purchasing decisions, and keeping a sharps injury log to track problem areas. Employees must also do their part. In the next 10 minutes, we'll walk through the 5 steps you can take to protect yourself and your coworkers from dangerous exposure to bloodborne pathogens. Studies show that needle stick injuries account for about 80% of all exposures to blood. Most occur while using hypodermic needles, blood collection needles, suture needles, and needles used in IV delivery systems. But the sharps most often associated with transmission of bloodborne pathogens are needles with hollow bores, like those used to give injections and draw blood. If a contaminated needle sticks you, you may be exposed to hepatitis B virus or HBV, hepatitis C virus or HCV, and human immunodeficiency virus, better known as HIV. Hepatitis B can cause serious liver disease, and nearly half of those infected have no symptoms. While the majority recovers from the virus, 10% become chronically infected. And every year, more than 5,000 die from related chronic liver disease and liver cancer linked to the virus. Fortunately, the hepatitis B vaccine can prevent it. Hepatitis C can also cause a serious liver disease known as hepatitis C viral infection. The symptoms are similar to HBV, jaundice, fatigue, abdominal pain, loss of appetite, and occasional nausea and vomiting. But there are some important differences. 3/4 of those infected with HCV have no symptoms, and 85% have chronic infections and may have no symptoms for up to 30 years. Yet all the while, the infection may be slowly damaging the liver. HIV can cause a breakdown of the immune system, leading to HIV infection and, in many cases, AIDS. The clinical picture of HIV differs widely from person to person. Some people may appear to be healthy for many years, but when the immune system loses its ability to fight infection, the person becomes seriously ill and can develop AIDS. It's important to understand that most sharps injuries do not cause exposure to bloodborne pathogens. And even if you are stuck by a contaminated needle, exposure does not always lead to infection. To become infected, a large enough dose of the live virus has to enter your bloodstream and overcome your body's defense system. To put it in perspective, consider the odds of contracting a bloodborne infection from a sharps injury. If you're stuck with a needle contaminated with HBV and you are not immunized, you have a 6 to 30% chance of contracting the virus. If you are stuck with a needle contaminated with HCV, you have about a 1.8% chance of contracting the hepatitis C virus. If you are stuck with a needle contaminated with HIV, your chances of infection are 0.3% or 1 in 300. The problem is, if you have been exposed to HBV, HCV, or HIV, you may find out you're infected right away. Or wait a long time to find out if you've been infected, and the waiting period can be traumatic and greatly impact your life and relationships. Any instrument or object capable of breaking the skin, needles, lancets, scalpels, rotating instruments, even broken glass, is considered a sharp. And any one of these sharps can pierce through gloves and other personal protective equipment. Over the past decade, many innovative new sharps have been designed that prevent injury before, during, and after use. According to the CDC, 62 to 88% of sharps injuries can be prevented by using these devices, including needleless IV systems, blunted, retracted, or shielded needles, retracted lancets, breakage-resistant blood capillary tubes, and certain protective surgical equipment. According to OSHA, immunization against the hepatitis B virus has proven very effective in preventing infection. After HBV immunization was widely promoted, the number of healthcare workers infected with HBV at work decreased from 12,000 in 1985 to 800 10 years later. But remember, to be effective, the vaccine series must be completed. If you are infected with bloodborne pathogens, you may have no symptoms for many years, but you can still be contagious. That's why standard precautions, a combination of universal precautions and body substance isolation practices, were developed. Standard precautions start with one basic premise. All blood, all body fluids, all excretions and secretions except sweat, and non-intact skin and mucous membranes are treated as if they are infected with pathogens. Applied to sharps, that means you treat sharps the same way. OSHA's revised bloodborne pathogen standard included the ruling that employees should participate in choosing what sharp safety devices will be used. That means you will be asked to evaluate the effectiveness of these devices. Make sure you know proper use procedures before you need a needle safety device. Use a safe needle device or needleless system for withdrawing body fluids, accessing veins or arteries, or administering meds or fluids. Use needleless systems or needles with engineering sharps protection for other procedures requiring needle devices, such as joining IV lines or suturing. When using sharps, follow safe handling techniques. Never shear, break, bend, or recap contaminated sharps. If recapping is necessary, use a resheathing device. Always direct the sharp's point away from yourself and others, and keep both hands behind the sharp instrument at all times. During surgical procedures, use longer forceps or hold at an acute angle to protect your hand. Use instruments, not fingers, to hold tissue being sutured. And keep fingers clear of rotating instruments. Use no-hands procedures to handle contaminated sharps and eliminate hand-to-hand instrument passing. And remember, your gloves should fit right. If gloves are too big or too small, they can make you clumsy and cause injury. 1/3 of all sharps injuries are due to improper disposal. To reduce disposal accidents, discard contaminated sharps in rigid, puncture-resistant containers immediately after use. Position disposal containers within easy reach and slightly below eye level, especially in patient and treatment rooms, and never reach into them or allow them to overfill. Protect yourself against sharps that have been carelessly discarded in trash, linens, or on a table or floor. And don't push trash down with your hands or feet. Instead, gently hold the top of the bag and carry waste and laundry bags by the top away from the body. If you are stuck with a contaminated sharp, don't panic. Wash the area immediately with non-abrasive soap and water. Never use caustic agents like bleach. Then report the exposure immediately so post-exposure evaluation, counseling, and any necessary treatment can begin. Remember, act quickly. Some treatments must begin right away to be effective. Report any sharps injury according to the directions in your facility's exposure control plan. Then document the incident in the sharps injury log. Include date, time, type of sharp used, effectiveness of any safety device, and how the injury might have been prevented. This information can help your employer determine what sharps and safety devices are and are not effective. Needles and sharps are important tools of the trade, but they can also be dangerous. Protect yourself and your coworkers from injury with the 5 rules to sharp safety. Get vaccinated against the hepatitis B virus. Treat all sharps as a dangerous sharp. Use sharp safety devices. Follow safe handling techniques and dispose of sharps properly. Habits like these protect you from accidental injury. Take the time to practice them.